Bore da bawb a diolch am ymuno gyda ni heddiw ar gyfer cyfarfod rhythwyr Bwrdd Ymddiriedolaeth Prifysgol Velindre. Good morning and welcome all to Velindre University NHS Trust Board's virtual meeting held in public. Byddwch yn gallu arsylwi y cyfarfod heddiw, ond ni fydd cyfle i chi gyfrannu. Rydym yn recordio'r cyfarfod a bydd copi ohono ar gael ar ein gwefan yn fuan. You join us today as observers, which means you cannot participate in the discussion. A video of the meeting will be available on our website as soon as possible. Cadeirydd y cyfarfod heddiw yw Cadeirydd yr Ymddiriedolaeth, yr athro Donna Mead OBE. Mae 6 aelod annibynnol arall gan y bwrdd fel y gwelwch o'r wybodaeth ac gyflwynir. Today's meeting will be chaired by the Trust Chair, Professor Donna Mead OBE. As you can see from the slide, the board also includes 6 independent members. Yn ymuno â nhw, mae aelodau bwrdd gweithredol y Ymddiriedolaeth. Joining them today are the Trust's executive board members. Croeso hefyd i rai o'n partneriaid allanol. We also welcome some of our key external partners to today's meeting. Mae'r bwrdd yn gyfrifol am reoli perfformiad a strategaeth yr Ymddiriedolaeth. The board is responsible for the strategy and performance of the Trust. Bydd y cadeirydd yn agor ein cyfarfod yn awr. The Chair will now open our meeting.
Bore da pawb, welcome to the Velindre University NHS Public Trust Board meeting. We are pleased to confirm that this meeting is being live streamed today and will be available on the Trust website should members of the public or indeed our staff wish to view it at their convenience later on. Those of you who've joined the meeting today, which I understand to be a mix of staff and public, welcome to you all. Croeso cynnes iawn i chi gyd. Before we start our meeting today, I have an item that is a little bit bittersweet, in that we want to welcome Margaret Foster, who is the chair of the NHS Wales Shared Services Committee, to our meeting, and I've asked Margaret to attend the Trust Board meeting today so that the Trust can formally mark her retirement from that position at the end of this month, Margaret, I think it is. So thank you, Margaret, for joining us this morning. In my briefing notes, staff have given me a copy of your CV. Well, it will take me till break time at 11 if I were to read all of that out. So I'm not going to do that. But what I thought I would say, look, Margaret joined the NHS in the same year as I did. So I'm not going to embarrass either of us by giving you the date. But suffice to say that it was quite a very long time ago. And Margaret has had an illustrious career in the NHS. And I'm pleased that I've had the opportunity to work with Margaret on a number of occasions, both in the East Glamorgan Trust, as it was then, and then later on in the Pontypridd and Rhondda Trust. And also when Margaret was governor at the University of Glamorgan, acting as the chair of the Employment Committee, and I was a dean in the university at that time. But I promise you, Margaret, I'm not going to follow you around anymore. After wherever you go next, I promise you I shan't follow you. Currently, Margaret, as well as being the current chair of Shared Services, also holds the position of Commissioner, Isle of Anglesey County Council. That's an appointment by the Minister for Local Government. So I doubt that you're going off into quiet retirement, Margaret. You're still going to be very busy. But I wanted to take this opportunity, as do we all on the board, first of all, to thank you for your work as Chair of Shared Services. I think much of the work, as far as we have been concerned, you've undertaken a little bit behind the scenes, but we've been very much aware of your leadership in Shared Services throughout your tenure there, and just wanted to take this opportunity to thank you for all the support and hard work that's gone into that, and of course to wish you all the very best going forward. Steve Ham hasn't joined us yet. He was hoping to say a few words. He's had to go to a meeting and is expected to join us by 10:15. But I don't know, Margaret, if you want to say a few words.
Oh, only to say thank you very much for taking the trouble to invite me and for those kind words. As you know, I've really enjoyed my chairmanship of shared services, and the relationship, I think, with all our colleagues has been excellent. And whenever we've had anything to do, we've managed to do it. We've worked together, and I think the success of shared services has been very much down to the way in which we work with Velindre, and indeed the arrangements which we have for hosting, which, although a bit strange, do work very well, I think, in practice. So I'd just like to say thank you very much. I'm sure I'll get an opportunity to speak to Steve again. So thanks very much for that. And I hope to continue in some form in the NHS. We'll see what that might be, but I'll keep you posted on that one. Thanks very much anyway. Thank you.
Thanks, Margaret. And we wouldn't want to let the occasion go without marking it with something a little bit special. So there should be a knock on your door later today, bringing a gift to you, which comes with our love and very best wishes for the future.
Thank you very much. Very much appreciated. Thanks a lot. No, not necessary, but I'm sure it'll be lovely. Thank you very much indeed. Thanks.
Thanks, Margaret. Okay, bye for now.
Bye.
Bye. So, colleagues, as I just said, Steve Ham has been called to a meeting, but he anticipates joining us by about 10:15. So I won't tender his apologies just yet, but I'll keep an eye out for him. I'm sure he'll be with us. So the only apologies I have are from Carl James, our Director of Strategic Development, Planning and Digital, and Phil Hodson is attending this morning to deputise for Carl. And a real pleasure to welcome Vicky Morris to her first Trust Board meeting since her appointment as our new independent member for Quality and Safety. So, Vicky, I can see you. Would you like to just say a few words about who you are, where you come from? I know that you've been busy meeting some board members, and we will have an induction program for you in due course, Vicky, but just to say a few words about yourself for us now before we start the meeting.
Yeah, certainly. Thank you for your welcome, and really looking forward to working with the Trust. I live in Mid Wales, married to a farmer with a couple of children, 27 and 25. And one's farming, one's in law, so very, very different, diverse careers for them. But I'm a qualified nurse, trained, you said about dates, back to 1987 I qualified as a nurse, and have been Executive Director of Nursing and Chief Nursing Officer for 18 years before I took my pension at the end of March, and then took some very clear time off over the summer to enjoy Mid Wales after commuting to various working roles over my careers. But I've had the pleasure of working in Wales in 2 or 3 roles, as well as in England. So in that capacity as independent member now, really looking forward to working with the Trust. And as you said, Donna, I've had an opportunity to meet all the IMs virtually, but obviously executive colleagues, I'm really looking forward to meeting with yourselves, and obviously meeting physically as well, which I really look forward to.
Thanks, Vicky. I don't know. I don't think there'll be much to be gained in the virtual environment from going around saying hi and who we are, unless, no, I don't think there will be much benefit from that. Vicky, we are planning, COVID allowing, we are planning to have our December board development meeting as a face-to-face meeting. So that would be excellent time to get to meet you and be able to chat over a cup of coffee, as well as the work that has to be done on that day. Lovely. So and we wish you the very best in your tenure with us, and we're all looking forward to working with you. Andrew Westwood is having some trouble joining us, so he's trying to get IT support to help us to join. I think, Lauren, that's right, isn't it? I just saw your name pop up, Lauren, that he's...
Yeah, exactly. Yeah, so we'll just we'll get you joined in through the other route, Andrew.
So hope Andrew can join us shortly. So as well as welcoming Vicky, I'd like to welcome our regular attendees who are very much part of our Public Trust Board. Stephen Allen, I can see Stephen, who's the Chief Officer for Cardiff Community Health Council. Is Brenda with us today, Stephen?
No,
He can't hear me.
yeah, so no chair. No.
Okay, thank you, Stephen. David Cogan, our very loyal, always attends, patient liaison representative. Welcome, David. Katrina February is our audit lead, performance from Audit Wales. James Krantz and Emma Rees are here from Internal Audit. And then I'd like to extend a very warm welcome. As I said, Phil Hodgson is here as Deputy Director of Planning and Performance, attending on behalf of Carl James. And we have three very special visitors this morning. We have Stephen Harry, who's the Board Director, Chief Ambulance Service Commissioner, who is going to talk to item 2.1 on our agenda, together with Dr. Chris Turner, who's the Chair of the National Collaborative Commissioning Unit, and Richard Baxter. I don't know if Richard is on screen. I can't see him, but I've said hello to Richard this morning. He's in the building, even if we can't see him. I know he's in the building.
Hi, Donna. We're trying to socially distance around a laptop, so Richard's in the room, but
okay.
He is present. I keep keeping an eye on both of us, Donna, to keep us in good order.
Okay, thank you. Well, welcome, Richard. Richard is the Task Force Project Manager for some of the issues that we'll discuss when we come to item 2.1. So in calling a start to the meeting proper, can I confirm the process for asking questions? If I come to an item which requires approval by the board, I will ask if you approve, and I would like you to raise your hands, please, so that I can note your approval, and the staff can sort of take a note of that and count that if necessary. And I'm very happy for you to use the raise the hand function, and I'll then do my very best to take questions and observations in the order that they're raised. Bear with me, I will do my best to get that in the correct order, or wave at me if all else fails. So turning to item 1.40, declarations of interest. Is there anyone present who wishes to declare any interest in respect of the items on today's agenda? No, can't see any hands up. So item 2, I'm very pleased indeed that our colleagues from the Emergency Ambulance Services Committee, ESC, as we know it, have joined us today to provide an update on some of the developments that are taking place. It's the first time, Chris and Stephen, I think that you have joined us. And you might think that we're a kind of bit of a small part player, but the patient transport system that we use and for kind of more urgent transfers are very important to us at Velindre. So we want to be as involved as you'd like us to be in the initiatives that you're taking forward. And looking forward to your presentation. Is that going to, we do have it in our pack, but is that going to go up on screen?
Yes, we hope that it will.
So could we have the presentation on screen, please? There it is. Thank you. Over to you, Stephen and Chris.
Okay, thanks very much, Donna. I'll start. I'm Chris Turner, for those who are viewing, Chair of ESC. Could we have the next slide, please? Thanks. I know this is a rather busy slide and not terribly easy to read, but it's useful, I think, as an introduction. I think, as the chair has already mentioned, this is the first time that Stephen and I have attended a trust board meeting. We do the annual round generally, but I think we're very pleased that we're able to come to Velindre Trust on this occasion. So this slide, as I said, is a little bit busy, but it tries to show where the Emergency Ambulance Services Joint Committee is placed, if you like, in the grand NHS scheme of things in Wales. So the committee is a joint committee operating on behalf of all the health boards. We're a commissioning body, so obviously our commissioning is to do with the services related to ambulances. Clearly, we have to work closely with the Welsh Ambulance Services Trust, but our role is to commission those services. You'll see on the slide that on the left-hand side is the operations that we have through the Chief Ambulance Services Commissioner, which is Stephen, and then underneath the red box of the joint committee are all our subcommittees. Now, just to remind you, the committee is made up of myself as the independent chair, and all of the members are, in fact, the chief executives.
Stephen, you've gone on to mute. Sorry, Chris, you've gone on to mute.
Did anything?
Yeah.
Sorry, Don, I don't think we actually did anything to mute that, but it seems to have done it itself. Can you hear me now?
Yeah.
Okay, thank you. Okay, so just reminding you that the committee is made up of the chief executives of the various health boards and also representatives from the trusts, and of course we also have the chief executive of the Welsh Ambulance Services Trust on the committee, which is obviously extremely helpful. So I don't want to dwell too much on that, but if anyone does have any questions later on, I'd be very happy to try and answer those. But I was just trying to place us in the context of the system generally. Could I have the next slide, please? So those are the commissioned services, and I would guess that your trust has an interest in most of those, perhaps more in the second two, but also in the first one. I think those are the services that we commission. They're there for you to see, and we'll cover all those in a little bit more detail when Stephen gives his part of the presentation. So next slide, please. I always put this up wherever I go. These, Donna, as you will appreciate, these are the priorities that the minister gives to me. And as you know, you'll all have your priorities. These are mine, the most recent iteration. I don't think there's anything that you would not expect to be in my priorities for the committee. There's obviously issues around public messaging and the use of ambulance services. We're looking, I think, as a committee for better ways of managing patients in the community, particularly at the moment when the system is under such stress. And obviously tied with that is the maximising alternative community pathways to avoid people perhaps turning up at A&E, which is a real challenge at the moment. I will draw brief attention to the last of those, which is the delivery of a more robust commissioning approach, which the minister was very clear about. Obviously, we'll do what we can, but we do want to work collaboratively with all our partners in trying to commission the right services. I'm not going to say any more at that point. I'll hand over to Stephen now. We'll have much more specific detail, which I hope will be of interest to the Trust.
Thank you,
Thanks, Chris. Good morning, everybody, and very nice to be with you. It's really nice to get an invitation to come along to the board. I think you're right, Donna. It's the first time we've come along, and we're very keen to make sure we continue a positive engagement with you in terms of enabling us to put in place the right ambulance services that we need to put in place across Wales. So we're really appreciative of the invitation. The reason I put this slide, can I go to the next slide, please? Ambulance service is an area which is usually in the is high in the public domain. It's a highly sensitive, quite rightly, a highly sensitive issue. One of the things that the minister was very keen to do, as with other services, was to make sure that as we come out of the pandemic, as we start to reset and reform health and social care across Wales, that we don't lose opportunities that we would have gathered during the pandemic in terms of ways of working. So we're not going to go back to how we were. If there's a better way of doing things, how could we how could we do that better way? How could we deliver that in a better way? So she established a task force, which I was a co-chair of, and she's now asked me to lead that task force from a commissioning perspective. It was essentially to make sure that we do have an appropriate transformation of ambulance services, and she was particularly keen around 3 areas. One, to make sure that we take that citizen-centered approach. Sometimes we concentrate too much on services and not enough on the individual. Secondly, that we understand better how we can improve productivity. I got a few slides that are specific to Belinda, which I think will help in that. We know there's great pressure in terms of workforce availability and well-being. We know that staff are really tired at the moment, so that's absolutely has to be a key element of what we do. We know that we can make better use of digital and technology to help improve service delivery. So how can we make that a priority in terms of what we do? And we know that we're on a journey. So we know that we have to go on an improvement journey and be able to measure that improvement. So those are areas that the Minister in particular wanted to focus on. I'm required to provide a monthly update to the Minister, which we do. And that document is taken through the EASC committee as well. So it's there fair and square in the public domain in terms of how we're taking forward these issues. Next slide, please. We don't want to give you death by PowerPoint, so that we haven't got that many slides, and obviously a conversation is going to be important. As Chris said, we're a commissioning body, so we issue commissioning intentions. Rather than give you the totality of those, I've just pulled out some highlights in this table. They focus on the emergency ambulance service, the non-emergency patient transport service, and the EMERTS service. In terms of emergency ambulance services, as well as these commissioning intentions, we also have a commissioning framework which has more detail in it. But these are clear high priorities. Make sure that we've got the right level of frontline staff available. Make sure we're focusing on that patient improvement. We know that we have a lot of patients go into hospital that don't need to go into hospital. So how can we provide alternatives to make sure they're treated in the right place and in the right time? We want to move into a value-based approach and in terms of how we commission. We think that's important. We have to demonstrate that for the commissioning allocation that we are provided with by all of you, that we're able to take that value-based approach, and also that we understand how ambulance service fits into the wider system, the interactions, and how we can learn from those and get improvement through those interactions. In terms of non-emergency patient transport services, there's a model called the plurality model, which basically means that WAST aren't the only providers of non-emergency patient transport services. They would be the provider of choice normally, but there are others that would be able to provide services. So we know, for example, in the case of Velindre, that a standard non-emergency patient transport service isn't going to be the right one. Indeed, the Minister has said that there are 2 clear priorities for non-emergency patient transport service. One is patients who need to access chemotherapy treatment. We absolutely have to make sure that they're not waiting too long for their appointment, to get to their appointment, to get back home, and also patients who are going through dialysis. So those have been singled out as 2 key priorities. So how can we tailor the NEPS service to meet those demands? I think we can have a conversation about that in terms of how we can work with you to make sure that we do that. And then I think the other element is that we need to transform NEPS as well as EMS. Things are changing. As we reset the NHS, we can't have an old NEPS service. We have to have another. We're on somebody else's laptop, which is why you might have heard another call come in, which is why I stopped. And then the last area is EMERTS services. This is the critical care transfer service, and I think this is a bit of a good news story. Actually, we now have that as 24/7 provision across Wales, and we also have a dedicated critical transfer service across Wales. So I think that's one of the success stories. Next slide, please. We are given an allocation of £216 million a year to commission ambulance services, and that's how it's broken down. Next slide, please. In terms of net activity, the top graph is the pattern of activity since April 20 across Wales. So this is what's happened in terms of how activity has started to build up since April 20, as we start to come out of the pandemic. Somebody's keen to talk to the laptop owner. The bottom graph is the pattern of delivery for Velindre. So as you can see, there's a very similar pattern. So as the net activity is picking up in Velindre, that's mirroring the pattern across Wales. So there's nothing that, and I think that's reassuring actually that is the case. Next slide, please. So this is the number of journeys that are aborted. So this is where we can get some greater efficiency, I think, into the system by reducing aborted journeys. And as you can see there, what we're finding is that the number of aborted journeys for Velindre is increasing. So I think there's something for us to go at collectively here, Velindre colleagues, ourselves, and WAST in terms of why is that the case, and how can we make best use of that. So we're keen to do that with you actually in terms of how we. I think it's partly down to the way the system. We book patients at the moment, but there might be other areas that we need to get into on that. There's probably something for us to go at there. Next slide, please. So this is how your patients get into Velindre, and we're comparing 2020 with 2021 here. So the three main ways in are either via a taxi, an ambulance, which has got wheelchair capacity, or a volunteer car driver service. So those are the top three. And if you look at the change in percentage for between 20 and 21, what you can see is that the percentage of volunteer car drivers has increased. It's gone from 14% to 21%. The number of ambulance journeys has reduced. It's gone from 31% down to 28%. And the taxi usage has gone down. It's gone down from 32% to 29%. I don't think that's a bad thing, because I think what's happening is we're starting to get into a bit more of a tailored service for Velindre. I think there's much more to be done, but we're starting to get there, I think. And this might be a good measure that we can use in terms of how are we going to monitor whether that change is moving forward or not. Next slide, please. And then if we look at the outward bound journey, there's an interesting pattern here, I think, as well. So again, you've got the top three. You've got taxis, wheelchair capability ambulance, and volunteer car service, 2020. And in 2021, you can see a big change. You can say much more. You see much more use of taxis. So it's gone from 27% in 2020 to 44% in 2021. Again, I don't think that's necessarily a bad thing, because I think it means that we're providing a bit more of a tailored service. One of the things we need to check is whether we've got the right balance between taxi and volunteer car service in terms of that. See if we can squeeze as much as we can for you out of the value of the contract that we deal with on your behalf in Velindre. Next slide, please. This is Ems Journeys. So these are where a frontline ambulance is needed to to transfer a patient into Velindre. So we have information here about 2021, and there have been 104 journeys. In terms of the average, in terms of some information that sits behind that, in terms of average response time, the average response time is about 2 hours, 126 minutes from the time that the request is made to the time that the patient arrives. Excellent in terms of the handover. Once the patient arrives, no delay in terms of the patient being handed over. And then the average age of the patient being transferred is 68 years. If we go on to the next slide. Next slide then is outbound journeys, outward bound journeys. So these are where patients need to be transferred out of Velindre to other hospitals. So again, we've broken that down by hospital, and we've had a look at the average response time. So the average response time here, just under 2 hours in terms of getting the patient back. There's not much difference there between the inward and outward bound journeys. Handover time is 27 minutes, so not as good as the inward journey. And then we've got the average patient age is 68 years. Again, I think this could be quite a useful measure for us in terms of responsiveness and how we can track this through to make sure that by putting the patient at the center, the individual at the center of what we're doing here, we get that timely response. We know what that time response is, and we can start to track it. We've got this information by hospital as well, so there will be some variation by hospital. We have that information, and we can make that information available to you. Thought that might be quite interesting as well for you in terms of that. We also have information where transfers take place on a hospital site. So you might think that if you've got a service on the same site, that means you wouldn't have any delays in terms of a transfer. But actually, it's the same sort of service. So you would still have to book an ambulance to transfer a patient on sites, and we got information about that as well. So we can do a bit of compare and contrast if that's of help to you in terms of the type of information that we are holding. I'm just trying to give you a flavour here of the type of information that we've got and how we can use that information. Next slide, please. One of the things that we're trying to do with WAST is almost turn the triangle around. So as I said at the start, I think we've got a lot of patients who are being presented into the wrong part of the system. We've got too many people going into hospital that don't need to go into hospital. And there's things that we can do, I think, to try and invert that triangle. So part of the transformational work that we're trying to do is trying to invert that triangle. I think it's really important when we do that, that we don't forget the specialised and specialist services that you provide in Velindre. The last thing I want is for the law of unintended consequences to apply. We do something that appears right for the broader system, and then we have an unintended consequence in terms of the service offer that we're making available for Velindre. So I think it's really important that we stay close on that and work collaboratively on that one. Donna, if it's okay, I'll stop at that point, and happy to pick up any questions. And then if there are a few priorities that you want us to take forward on your behalf, how can we start to understand what those are and take those forward?
Thank you, Stephen, very much. That was really very interesting, and to see some of those figures presented in that way. I'm going to open it up, but I've got one question that I'll kick off with the patient transfers from Velindre to another hospital. Do you have any information that differentiates those patients who've been transferred to another hospital because they perhaps came to us from they're an inpatient in another hospital, they came to us for their chemo or their radiotherapy, and then they get transferred back. So they're an outbound patient from Velindre to a hospital where they were an existing inpatient.
Yes, the straight answer to that question, Donna, is that yes, we would have that information and we can provide it to you. It's not something I can just press a button on and the machine and the system churns it out straight away. but it's something that we could interrogate and provide you with information on. Absolutely.
Thanks, Stephen. So if you could take the slideshow down just for a minute. I can see Kath's hand is up, but I don't know if there are any. Kath, I'll come to you next, and then I can see if there are hands up. Oh, Steve Ham has joined us. Welcome, Steve.
Thank you, Chair.
Kath.
Hello, thanks. So I'd just like to say thank you really on our behalf for the flexibility and the changes in response to our service needs that we've received over the last couple of years, in particular, when we had to make changes to our service provision in response to the pandemic. And to note with interest some of the data that, of course, the operational teams do have from you. Our Velindre Futures programme has got a key focus on our outpatients and our SAP provision, which are both areas in which our patients are provided with the transport service. And as part of that, we're really keen to work further with you on more detail of who we're taking where and when, and to look at making sure that we're able to maximise the offer we're making and make it as good as it can be. So I know we're keen to pick that up with you now over the forthcoming months as that piece of work really starts to take hold. So look forward to it.
Thanks, Kath. That's kind of you to say, and we're very keen to continue to build on the working relationship that we've got. So basically, we're happy for you to use us in whatever way that is beneficial for you. The more we know about what you're doing, the better chance we have to provide some positive impact, positive input into you in terms of what that might look like from a transport or an ambulance service provision point of view. We're very keen to do that. So thanks for that, Kath.
I can't see any other hands up, but if does anybody else have any queries? Gareth.
Thank you, Chair. I was interested in the figures about the aborted journeys, and I was wondering whether the percentages that you shared with us are representative of the ones you're seeing with other users as well.
I think the reason I put it up, Gareth, is I think for two reasons. One, I think we've got a pattern where it's increasing, and I think we need to understand why it's increasing, and is there something that we've missed that's changed that has inadvertently caused that? That's the first thing to say. Second thing to say is I think the proportions are slightly higher in Velindre than they are in other places, so I think there's definitely something for us to go at there. I think it's probably a system issue rather than a colleagues working together issue, and sometimes those are a little bit easier to fix in terms of processes, in terms of what we can do. But of course, because the offer to Velindre is more specific, I think we have an opportunity to get into that in more detail and make some changes and make some difference here, Gareth. So I think that's why I put that up. I think there's definitely something for us to go at in this area.
Can't see any other hands up. One of the things that occurred to me as we were going through, oh, Steve, I'll call you in just a sec. Some of the activity analysis, Stephen, is where there have been dips in demand over the last year, 18 months. It's been because I'm sure that part of that is accounted for by the increase in virtual consultations that we've been doing, and not bringing people into outpatients. So it'll be really interesting to see how that calibrates itself out as we're in the post-pandemic era, because we would hope to continue to have, where appropriate, virtual consultations, which in many cases will avoid an ambulance journey or a transport journey, should we say.
I agree with that, Donna, and I think it's really really important that we stay close. So as you start to redesign your services in Velindre, we understand what that looks like from a transport or a EMS perspective, and I think if the number of journeys reduce, then how can we make that more of a bespoke service to the patients that really need to come in? Because if they really need to come in, then they really need to be there on time. They need to be there for as little time as they need to be there for, and they need to get back home as quickly as they can. So how That's, I think, the trick for us in terms of this. If the numbers are coming down, how can we improve the service offer for those that really do need to come in? It's that balancing act, I think, Donna, that we need to work our way through. The other thing that we're doing, Donna, is we're trying to we're intending to put a more bespoke transfer and discharge service in place with WAST. So at the moment, instead of just using the general frontline fleet to do transfers and discharges, how can we have more of a bespoke service from the resource that's available? So again, that might be of interest to you in Velindre, and obviously we'll involve you closely and the team closely in that work as that work develops.
That really makes sense and would be most welcome, I think. Thank you, Steve.
Thank you, Chair. Apologies, Stephen, Chris, for me being late. I was in another meeting, which is unavoidable. You touched on a bit of my point, actually, Stephen, in terms of the bespoke nature. I think it's really important. Everybody wants it to be bespoke, and I think there are limits where you can get to some of that. But I think it is a really important conversation, because as I talk to staff, I think the nature of the services drive a different model. So the requirements to getting somebody in for a radiotherapy appointment as opposed to a SACT appointment, they're different. And I think getting to that level of granularity in conversations with the staff, I think I'm looking at Kath in particular on this. How do we get that conversation going so that when I talk to some of the staff, and the transport doesn't help us either in terms of them managing their flow for the day. And it goes back to, as we change our services, how do we engage with you? Because that becomes even more important, and as we value patients' time as well, and any impact we have on them. So I think that would be an important conversation, and I guess we'd feed that in through the non-emergency patient transport group. Is that where we'd feed that in?
I think there's a couple of things on that, Steve. So firstly, I absolutely agree with you. I think there is a different model required in Velindre, because you're either trying to make sure that you're making the best use of the highly expensive equipment that you operate. So so it's really important that people come in on time for those slots. We can't have people waiting for those, either in terms of an efficiency point of view or patient care point of view. And secondly, in terms of the treatment they're getting, they don't want to be staying around in hospital. We need to get them back out home as quickly as we can. So that bespoke side of the service, I think, is really important. So I agree with that. What we'd be happy to do, if it's of any help, is as well as taking it through the NEPT's delivery assurance mechanism, we'd be happy to have specific conversations with you. So maybe a workshop or a virtual workshop, something, so we can listen and understand absolutely what the needs are, and then have a constructive conversation about what's practical to do, how do we gradually move things forward and get some improvement, and how might we go about doing that. So happy to engage in whatever way you or Kath feel are appropriate in that regard, Steve.
Okay, thank you.
One of the things, other items we've got on our agenda today are patient experience reports and so on, Stephen and Chris. And I haven't noticed any complaints that are due to ambulance response times or waiting times. But would a patient complain about that to us, or would they complain about that if that were an issue for them directly to the ambulance service?
Okay. Two things on that, Donna. I think the first thing is we do monitor the number of complaints. There aren't a great. It's exceptional when we would get complaints from a Velindre point of view. I agree with that. In itself, that's not enough though. But what we need to do is be a bit more proactive about that. So we shouldn't be waiting for people to complain. We should be going on to the front foot a little bit more about that, and how can we do that, and how can we link in with your patient experience mechanisms. Make sure these are included in those, and then learn from those to help us to influence commissioning in the future. So good point, Donna. I agree with that.
Yeah, thanks. Nick?
Yeah, thank you, Chair. Just to come in on that, so I'm not aware of any formal complaints that we've received as such. I think there are some experience issues that we have seen, particularly when on the rare occasion we've had a patient transferred over for treatment and unable to transfer back due to transport delays. It's usually due to the need for a very specialist form of transport rather than the general transport. But as you will be aware, Chair, we are just sort of really increasing our use of the electronic patient experience software, Civica. And what we'll do is make sure that we link in with the service in the event of us having any such feedback through that mechanism as well. So we are starting to capture a much greater number of feedback from patients rather than waiting for complaints to be received.
Thanks, Nicola. But I mean, I think of itself, the fact that there aren't any doesn't take away from the fact that we proactively need to garner what the patient experience is, but it's also noteworthy that we haven't received any complaints. I think this has been an extremely useful session, and as well as noting the slides and the trends and the analysis that it provides for us, which is very interesting. I also welcome the invitation, Stephen, from yourself to work with our teams to think about a more bespoke model for Velindre, to increase efficiencies, to increase value, and to increase value for money and so on, and to increase patient experience. And I think that is an invitation that I know our Chief Operating Officer and our medical nursing director are going to welcome with open arms. So I want us to go from this meeting absolutely now determined that we will take up that offer and meet with you. I mean, it's not that we've got such a long way to go. You're only across the campus from us. I was going to be a bit cynical in my opening remarks and say thank you for coming such a long way today to come and meet with us, but you literally just walk across the car park. So we could
as usual, Chair, it's our pleasure to walk all the way across the car park to come and see you, and there's no escape for us, is there? We now know that we will definitely be working more closely together in terms of these issues. We already have an excellent working relationship with Kath and colleagues, so yeah. We're starting from a strong base, Donna.
Thank you both.
Donna, can I just
yeah. Chris.
Yeah, can I just say that it was really good that you and I had a very informal conversation about us possibly coming to meet. And I think certainly from our point of view this morning, it's been really helpful to hear from your board, where we are. And as Stephen says, we are responsive. If you want to work with us, we will work with you. And I think there's lots of areas where we can make a lot of good progress. So that was a very fortuitous discussion we had when we agreed to come and talk to you.
Absolutely, Chris. And it was a meeting that we had over a cup of coffee, so there's something to be said for meeting in person yet. I hope we don't do away with meeting in person for all time because of our response to the pandemic. But thank you, Chris, for being so responsive. I know you've liaised with Stephen, Harry, as some of our officers as well. This has been 30 minutes well spent, and I think we've made a note of all the actions, and we'll through an appropriate mechanism we'll make sure that there's momentum now in taking this forward, and I look forward to the outcomes, which will be of benefit to our very vulnerable patients.
Thank you.
So thank you both. It's been interesting listening to the ringtones on whoever's computer it is. Very nice ringtones, but I don't think it spoiled it too much, so don't worry about that.
Thank you.
Thanks very much.
Thanks both. You're welcome to stay, or I expect you've got you're busy with other things.
We got a long way to go back to our headquarters, Donna. So we better set out. Yeah.
Better set out. Yeah. Yeah, let us know when you arrive safely so that we don't have to send a search party for you. Bye, and thank you, Richard, for attending as well. We haven't seen much of you, but thank you, Richard, for attending also.
Thank you.
So we now come to item 3 on the agenda, which is all right. Andrew is now fully with us. Welcome, Andrew. Andrew had some difficulties joining us earlier.
Thanks, Donna. Can you hear me as well?
Yes.
Okay, I do apologise. There's some strange things going on with Zoom settings, but I'm here. I can see you all. I don't think you can see me for some reason. I can't fathom, but I'm here.
I could see you, and now you've gone again.
Oh, I don't know what's going on this morning, Donna, but I can see you and hear you, and I can take part. So I'm here.
Right. Well, in case I can't see you, shout out if you want to join. Make an observation or a comment, and we'll get you involved.
Thank you.
So we now come to section item 3 on the agenda, which is the consent item. And I'll explain this so for Vicky and others will understand. So we put a number of items into consent section of the agenda for which the papers have been circulated in advance, and we don't anticipate there being much discussion around those items. However, at the beginning of this section, I always invite board members, if there's any item, or obviously if there's any item that's in consent that you want to discuss, if you let me know now, and I'll bring it out and put it into an appropriate part of the agenda. So is there any item in consent that warrants a discussion?
Yeah, there was an item raised by Gareth.
Gareth, did you want us to take an item which I think was to do with shared services? Yeah.
Yes, item 314, please, Donna. It is a minor amendment which I corresponded with Lauren about this morning. So it'd be helpful, please, if we could take that out.
Thank you. So I think I'll take that now, actually.
Okay.
So Gareth, over to you. So this is item 3.14. It's the revisions to NHS Wales Shared Services Partnership Standing Orders. And we're asked to approve the amendments to the standing orders as set out in the paper, which is in your pack. And Gareth, you had a query.
Yes, it's a point of detail, Donna, if I may, in relation to 4.8.4. And it's an amendment, I think, in order to reflect what the actual arrangements are. So if I may, I'll read out what it says. And it relates to the local partnership forum with shared services. But it says the chairs are accountable to the board for the conduct of business in accordance with the governance framework and operating framework set by NWSSP.
Yeah.
And I don't think that's strictly correct, so that the amendment which Lauren has proposed, and which I'm happy with, is that it should read now: the chairs are accountable to the board for the conduct of business in accordance with the governance framework set by the trust and operating framework set by NWSSP. So just to make that distinction, that the governance framework is set by Velindre and the operating framework is set by shared services.
I think that's it's very nuanced, but a very important distinction, Gareth, and I'm grateful to you for picking that up. Can I just ask them for a show of hands if colleagues would be content to approve that the shared services amendments to the shared services standing orders, subject to that amendment? Show of hands. Thank you. Anybody else want to? There's no hands up to bring anything out of consent. So we are therefore approving the Public Trust Board minutes of from the meeting held on the 30th of September. And we're approving the Chair's urgent actions report. And we're also approving the commitment of expenditure exceeding the Chief Executive's limit. We note the Emergency Ambulance Services Joint Committee briefing from their meeting, which was held on the 9th of November. And that concludes the consent item agenda for this meeting. So we now come to section 4 on the agenda, which is, oh, let me find it on my papers, which is the action log for matters arising, which is item 4.10. I'm just going to pull it up. If we go through it, we note the number of items which are closed. So if I could just refer to the items which are open. So the first one is the audit committee highlight report, private patients' debts, to be a standing item on the committee highlight report. So we note that the next audit committee, which was when this was written, was scheduled for the 14th of October, with a highlight report to be presented to the November Trust Board, which is today. So Martin, can I hand over to you to, you're on mute, Martin, or I can't hear you anyway.
Yeah, sorry, you don't look on mute.
Yeah, you are. It does say it's got a red line through your microphone symbol, Martin. It says you're on mute. Don't know what to do now.
Chair, should we come back to this if Martin may need to come in and out of Zoom? I think he and Matt have talked about this action.
Yeah, I'll go through the rest of matters arising, Martin, and see if you can perhaps reboot or something and come back in.
Well, Chair, I can provide the update because I've had a conversation with Martin, if that's okay.
Okay, cheers. And Martin's nodding. Thank you, Matt.
Yeah, so basically, Martin has agreed that because we've got ongoing reviews of the private patient debts through the audit committee as an ongoing item, that we close the action on the board, and then clearly if the audit committee then has any further issues it wishes to raise, it will flag those up to the board. Is that acceptable? Because it's an ongoing discussion through the audit committee with an open action there.
Yeah, so I'm content with that. Martin has now left us. I'm sure he's going to rejoin, but I did see the correspondence about that earlier today, so I'm happy with that, so that we close that item on the agenda now, and the audit committee will take the lead on that and escalate to this board if appropriate and necessary. So the next item is delivering excellence performance report, period July 2021. The Trust Board requested information on the development of an electronic data collection system for clinical oncology strategic targets cost, and that's included in future performance reports. Kath, do you want to take this one?
Yes, Chair. The action was to be closed in January when the reports fed through, but we actually actioned that more quickly than we anticipated, and that's actually already on the papers for today. So I think we can close that action now.
Okay, I've still got a number of queries about it, but we can close it here. If there are more queries, it can become a new action if necessary. Okay. And I think that's all. That's the open items. Anybody want to raise anything in relation to the closed items? I might regret asking that now, but Martin, can I check if you can speak to us? No, can't hear you. No. He's gone again. Okay. So that was item 4.10. So if I can take you now to item 5. The first item there is the chair's update. So this is my report to the board. Just for Vicky, I always provide a report to the board, and as does the chief exec, and we try and liaise between us as to what's appropriate to report. So the first section there shows everything that we've done in our board briefing session since we last met. And I think you can see from that that we've covered a huge amount of ground since the last meeting. There have been a number of items which we've discussed, worked through, etc. as a board. There's a lot going on. Item 2.12, the Component Development Research Laboratory. This has been reported through to Quality Committee, but I really wanted to bring this to the board's attention, and it was through my chair's report that it was the most appropriate way to do it. I am so proud and pleased to note this development in the trust. It's the Welsh Blood Service. They launched their Component Development Research Laboratory in October, and the links are still there for you to experience that whole event. You know, the presentations that were made, a kind of virtual tour of the lab and so on, and to meet some of the team. Why it was so satisfying to me is that I've before the pandemic arose, we had a research half day in the Welsh Blood Service, and at that time there was a kind of proof in principle presentation about what we could do to extend the shelf life of platelets, and also to maximize the use of platelets for our patients. But it was very early stage, and now we've gone from proof in principle to the proof in practice stage in terms of the shelf life of platelets and optimizing the function of platelets for our patients. A lot of hard work from the people involved, and there's been a KES studentship, that's a knowledge exploitation studentship, PhD studentship, with Cardiff Metropolitan University, and we had the opportunity to meet the student concerned. I'm going next week, I think it is, for a tour. I wasn't able to go on the day because we were conducting interviews, and if anybody would like to join me, we'd have to follow COVID regulations, but if anybody would like to join me, I can give you the date through the office, and you'd be very welcome to come and see the exciting developments in that lab. Failing that, please take a look at the events of the day, which you can experience virtually. I also want to note that we had a very powerful Armistice Day service on the 11th of November. This is a service which is becoming more and more important to the organisation year on year. We were joined by 2 or 3 Wales Field Hospital staff and their commanding officer, who also works in our radiography department. We laid wreaths at our little memorial stone. We also had we had Last Post and Reveille played by a member of our staff from fundraising, and throughout the organisation, in headquarters and in the Welsh Blood Service, there was 2-minute silence held, and I was very pleased to see how many, you can't see it from the photograph here, but a significant number of our staff at the Cancer Centre came to join us for the service. Please note the Macmillan's Professionals Excellent Award 2021, for which our team have been shortlisted. Sure, some of you have seen Dom Delivered, which was filmed well over a year ago, but this is Dom Delivers, a series where he follows various industries. It was an hour-long program showing what happens when a donor leaves his house, to go to a centre and donate a unit of blood. For what happens from the moment that person leaves their home until the unit of blood arrives at a hospital. And it was interesting. Of course, it was very interesting. But what also came across to me was the sheer professionalism of our staff and the way in which they explained quite complicated issues in ways that any lay person could clearly understand. And I was very proud of that. We're delighted to inform you that Dr. Meredith Evans, our consultant oncologist, has been appointed as the new director of the Wales Cancer Research Centre. We've all met Meredith in this board meeting when she's been presenting the research component of Velindre Futures, and I'm pleased to say that she will carry on leading that initiative, as well as having a new director role. Congratulations to Nicola and her team. We had a very successful research day for nursing, allied health professionals and clinical scientists, with over 60 people from across the trust and outside joining us for that event. And an excellent external speaker. I don't think her name is Bridge, I think her name is Bridget. That's a little typo there. That was an excellent event and the first of many, I hope, Nicola, going forward. The RCN Nurse of the Year Award was held earlier this month. The Trust has sponsored the actual Nurse of the Year Award for several years now, and we did so this year as well. And that was just amazing. But the thing I'm excited about and want to get to is that one of our staff, Diane Rees, who is one of our navigators in the Velindre Cancer Centre, she won the Healthcare Support Worker category. And we're very proud of Diane. And I want to, on behalf of the board, extend our sincere congratulations and best wishes to Diane for her achievements, which have been rightly recognised. Then I wanted to note that during the pandemic, a number of our young ambassadors, and these are children, have been very busy in trying to raise funds for the charity. And between them, during the pandemic, over £45,000 has been raised, and these are children, some of them quite, little children to very young teenagers. So we had an event. It is important that we recognise and acknowledge such commitment and dedication and citizenship in our youngsters. So a trampolining centre in Cardiff gave us the facility, free for an evening. And we presented each youngster with a certificate outlining what they had done, which was signed by senior officials in the organisation, and they each were given a medal, which was presented by Sam Warburton. And I think Sam Warburton was signing, then after that, Sam Warburton was signing shirts and rugby balls and so on. And the children really enjoyed it, and they'll carry on fundraising for us. And then finally, I just wanted to say that I've had my final end of year appraisal with the Minister, who has now written to me to say that it was deemed that all the objectives were met. But of course, I haven't met all the objectives. The board, the trust has met all the objectives. And I just wanted to put on record my thanks to all the team for all of the hard work involved in meeting those objectives, and for bearing with me in the weeks leading up to the appraisal when I was seeking information and data and being a bit worried about it. So I'll take any comments or questions or observations. A busy report. We've been busy.
Chair, if I can. Firstly, to check if you can hear me.
Is that you, Martin?
Yes, if you can hear me, yes.
Yeah. Hi, Martin.
Just in the last piece about your appraisal, when you said it's your last appraisal, you don't mean that at all. You mean it's the end of your appraisal, don't you? You're not going anywhere.
No, the last one that I had done. No, I'm not going anywhere just yet.
I just wondered, because the appraisal obviously was set by the previous minister and yet sort of done at the end of year by the new minister. I wonder if you've detected any change in emphasis, perhaps. Obviously, the government hasn't changed, just a minor reshuffle of individual pieces. But have you seen any change of emphasis, any change of sort of what Welsh Government would like to see out of us?
I haven't had a meeting yet about objectives going forward. I think the Minister wanted to round off that process because, as you rightly say, she was not the Minister that set those objectives. It was the former Health Minister. And as you might imagine, the things on her mind are COVID, population health, and our healthier Wales, and taking that agenda forward. So I have a meeting, the chairs and chief execs, we've got a meeting with the Minister this afternoon. We'll be interrupting part B of the board, and It's at that meeting that she's going to set out her priorities for us. I've had a letter to that effect, Martin, and I will circulate that so that you can all see. And then when my objectives have been agreed between us, I'll circulate those to the IMs in particular. Would that be helpful?
Yes, thank you, Chair.
Thanks, Martin. Right, I'm going to ask Steve now, please, to give CEO update. Steve.
Thank you, Chair. Just a couple of things. I'll leave most of the report speak for itself. I just mentioned the application for judicial review. As the report sets out, that was heard last week, and the position is set out there. Just to mention that there's still a consideration of the application of the Our House Convention around costs, which will be considered, not heard, by the judge over the next couple of months, and we've submitted our comments on that within the timelines. I would mention and welcome, you probably did this when I wasn't here, Kath to her first meeting as the permanent Chief Operating Officer in the organisation. So nothing changes, but everything changes, Kath, I think is the conversation we've been having. And one thing that's not in the report, which I do want to mention, is at the end of October, you will all have seen the coverage around us doing some work on site and clearing some shrub. Just to let the board know, we're meeting with key stakeholders, including community groups, to get any learning and anything that we need to take into account to adapt what we need to do and the approach we take for future work on the site. I just wanted to mention that because it isn't in my report. I'm happy to take any questions on anything else. Just 1 second.
Thank you, Steve. Are there any questions for Steve? Thanks. Thank you. So we come to item 6 on the agenda, quality, safety and performance. First item there is quite a long highlight report. So I'm going to hand over to Stephen Harris, who was keeping the chair warm for Vicky, to talk to the highlight report. Thank you, Stephen.
When you say keeping the chair warm, you mean the thing one sits in rather than yourself, I presume? So as you say, I was covering for the IM position pending Vicky's appointment, and we've just got this highlight report to run through. And I say, obviously, welcome to Vicky, who will be taking back over the chair role from subsequent meetings. So just in terms of this particular highlight report, first thing I'll draw the board's attention to is the, under actually heading 3, the second paragraph there, just a little bit of additional narrative to try and put a bit of context to the entire highlight report, is around the emerging benefits of the committee restructuring, particularly in terms of what we're terming triangulation. In other words, joining up different pieces of information from different parts of the organisation to try and understand the overall picture in terms of performance and delivery. And during that triangulation process, we did identify in particular in the committee meeting a number of common issues, particularly COVID-related issues around staffing, staff absenteeism, sickness levels, social distancing, and that being coupled with increasing demand for our services, and in certain parts of the organisation, particularly radiotherapy issues around equipping. Those areas in particular relate to parts of the Welsh Blood Service, parts of SACT, and in particular our radiotherapy services, which neatly then brings me on to the first item to highlight, which is the item in the alert escalate section, which flowed out of the Velindre Cancer Centre, the performance report, and a number of issues identified and discussed there around delivery against the radiotherapy standards and the targets. And at the moment, a number of targets which are in the red zone, as in underperforming. So we had quite a lengthy discussion around that and trying to understand that. And we noted in particular, as is commented on here, that Silver Command arrangements are or have been put in place to focus on, and particularly to address those issues. Now, I know, Kath, you'll be coming back to this when we come to your performance report. No need to comment at the moment. But I'm just presenting this highlight report. We will be coming to say no when we come to Kath's Cancer Centre performance report, which I think is the next item. So in terms of advice, I'm not going to go through every single item here. I'm going to take them as read, but just to pick a few out. So under advise, the committee received the donor, rather than the patient, the donor improvement story, the Welsh Blood Service, which is an update from members of the team at Welsh Blood Service around improving the process by which donors actually book on to a donation centre and session, and avoiding a situation which occasionally arises that donors are able to book, but actually don't qualify to give at that session, perhaps because it's been too soon since their previous donation. So that was a very interesting presentation. It's in the form of a video. We received a link to view it in advance of the meeting. If anybody else would like to see that interesting video, then I know that link could be shared. Skipping then down, we received an update from the medical director, thank you, Jazz, around the medical engagement survey. Now, this is a national survey undertaken once a year, and again, information is there for you, but the upshot of that being we're getting very favourable comparisons as a trust in terms of our medical staff engagement, and very positive. And that further work, as mentioned, is advised to further explore the themes and obviously to continue to develop and improve. I mentioned the Velindre Cancer Centre performance report. As I say, we will come, I know, to that when Kath discusses it in the next item. It's here in advise rather than assure, because it was quite a long conversation, long discussion, about 45 minutes spent going through the performance report. A number of questions raised. I want to say thank you particularly to Stephen Allen, who's the CHC representative who attended the committee and who's on the board today. Thank you, Stephen. You raised a number of interesting and important questions from the patient and the public perspective. And I think part of the outcome of that is, again, for us to reflect on our arrangements for reviewing the performance management framework, which is ongoing, with a view to completing that by the end of the financial year. And I think there was a recognition there that perhaps we need to do a little more work around engaging with the CHC, with Stephen, just to make sure that the performance reporting framework meets your expectations and requirements as well. I know those arrangements either will be put in hand if they aren't already in hand, and I know Kath will want to just have an update on that as well. Moving further along, we received an update and assure on we've mentioned shared services already today. So the shared services, the service which they call the CVAS at IP5, which is a medicinal preparation service, it needs from time to time to be licensed and relicensed by the Medicines and Healthcare Regulatory Agency, the MHRA, and there was an inspection visit recently, and again, full compliance with standards was reported to the committee. So I'm just sharing that with the board for assurance. Skipping then down, we received the trust risk report, the WBS divisional performance report. We had an update on a 15-step challenge, which was undertaken back in October by Nicola and supported by Hilary, another member of the team. So thank you for that. That was a very interesting and informative update. And then continuing on down, we received, this is the top of page 9, the annual estates update. We had a conversation there about apparent significant increase in gas consumption back in January at the WBS, and an explanation was given as to why that arose as a result of changes to the ventilation plant. We then had an update on putting things right and on health and care standard self-assessment. But the one I particularly want to come to, almost to conclude on, is the patient donor experience 2020-21 annual report, which again is a bringing together of all the different sources of information for the experience of our patients and our donors as they engage with our services for the year ended last March. Again, it's there for you to read. The experience report is actually attached as Appendix 1, so it's 6.1.b in the papers for you to read for yourself. Again, it was a very interesting opportunity, a two-part reflection in a sense, as we reflected on the enormous achievements of staff, teams, individuals, colleagues over that 12-month period, when the clinical world, in a sense, was completely transformed in the sense of how we engage with patients, how we deliver our services. So many positive things highlighted out of that report. Obviously, the committee also recognised that certain negative aspects were identified, areas for improvement, and these very much areas for improvement as an organisation, as a board, and as a committee, rather than actually trying to pinpoint any individual members of staff or any individual teams. That report mentions there are going to be various deep dives into some of the areas which perhaps are areas for improvement, and it was agreed that the outcome of those deep dives will be reflected in the next annual report for 21-22, which is the year we're in at the moment. And what we also asked is that we, obviously staff, colleagues, teams have been under enormous pressure over the past 18 months or so, but it would be helpful to try and get the annual report perhaps earlier in the business cycle, rather than having to wait as we did till November, 8 months after the event. It would be helpful to try and get that earlier in the business cycle. So I then conclude this just by pointing to the Quality, Safety and Performance Committee annual report, which we received, which included the committee effectiveness survey findings, and that report is attached as Appendix 2. So I'll conclude there, Chair. It's a very long report, which reflects a very long meeting, because there's an awful lot of business transacted by QSP, and it's obviously important that we spend the proper time considering all of these many matters, and that we then in turn reflect that back up to the board. So I'm happy to take any questions. I may need to pass those on to colleagues, but I suggest if there are questions about the Velindre Cancer Centre performance report, that we hold those back for consideration in the next time.
Yeah, thanks, Stephen. That's a good point. So we'll take any Velindre Cancer Centre performance issues in the next agenda item. Stephen, thank you. That was a very long report to read, and it took quite a lot of time to talk to it. I found it a very helpful report indeed. There's a lot of work goes through that committee. And I know, Lauren, we will be doing a sort of review of our new committee structure, but that work has begun. And just to make, you did mention, Steve, to make sure that we have sufficient time to look at all of the agenda items that need to be addressed in that committee. I've no doubt at the moment that they are being addressed, but it does make for a long committee and a lot of papers to read. So having said that, I can see a couple of hands up. I wanted to say I've read the annual patient and donor experience report, and I'm not going to raise it because it's been dealt with as a deep dive in the QSP committee. I just wanted to say, though, that several issues which I have raised in quality committee and possibly a board over the last year, I was very pleased to see that they're addressed in that report, that actions have been taken. So I wasn't talking into the air or talking in vain. They've been addressed. And I was also very taken with the openness in that report. You know, where people, if patients are saying this, we receive it, we accept it, and we're going to look at it, and we're going to do whatever. I felt there was a great spirit of openness in that report as you read through it. I don't want to pick up any particular items because that's been done in quality and safety. But Nicola, I wanted to say, and Jazz, to say to you and the team, I was very taken with the openness with which any items which need to be pursued were addressed in that report. So I now have Martin, who I think was up first, and then Stephen Allen, and then Nick. Martin.
Yeah, thank you, Chair. I endorse everything you just said about the donor experience and patient experience report. What I would say, this obviously covers 2021, the heart of really adapting to the pandemic. And what I would say is, as a donor myself, I was really pleased by our very early communications around all the messages about when travel was allowed and not allowed, and the messages we got through that the donating was essential travel, really did cut through it. It seems to me, and that was really good and really positive. The other thing I just say quickly about this highlight report is it's really helpful to see that, Stephen introducing by talking about triangulation and the assurance that all the other piece of work that don't necessarily come from audit committee still are part of the whole assurance sort of framework, and it's really helpful to see the sort of the IP5, the MRHA accreditation. That's really helpful to understand those things and see the whole range of activity. So whilst it's a long highlight report, it's a very helpful highlight report.
Thank you, Martin. Stephen?
Yeah, thank you, Chair. Just picking up on what Steve Harries was saying about the meeting, about the performance report. Yes, we've already arranged the meeting to meet. So I was going to give the board the assurance actually has been action straight away, and I'm meeting with Kath shortly. I think we're trying to tie a date and time in the diary that we can actually meet. So that is coming, Chair.
Thank you, Stephen. Much appreciated. Nicola?
Thank you, and thank you for the positive feedback in relation to the patient experience, donor experience annual report. Clearly last year was a challenge and the volume of capture was less than what we would like. The only point I wanted to raise was in respect of the number of papers, the length of papers, etc. at the committee. What we've done, as detailed in the committee annual report, is that been working with colleagues to really look at our work plan, look at the work programme, make sure that the frequency of reports is what's needed, make sure there's nothing missing, and we have rejigged the work programme, and that will continue, and that in conjunction with the work that we're going to be doing around quality of paper writing for assurance, will lend itself to more succinct papers, but providing board and committee members with the level of information and detail that is required.
Thanks, Nicola. That is really helpful and very welcome. It's the right balance, isn't it? And it's not going to. There's probably been a bit of trial and error as we get to the right point. Hilary.
Thank you, Chair. In respect to the annual patient experience report, I thought that there was an extract in the report itself of the survey and the responses. I thought that we'd agreed that the whole survey would be included as an appendix to the report, and I can't see it there at the minute.
Apologies for that, Hilary. I'll get that added and then recirculated to members, and it has yet to go for translation. So prior to publication on our website as well, we ensure that the whole survey is added in.
Thank you.
Thank you, Hilary. Is that okay? Yeah, we get that. Yeah, and it was a fearless report. We had it warts and all. Where patients complain, I'm always very assured if concerns and complaints have got as much profile as compliments and so on, and it did in this report. It was a very balanced report. We've discussed this report and we're asked to note it. I don't think there are particular actions coming out of it other than to endorse, Nicola, your approach going forward. I think we would all endorse that, and we will circulate the results of the survey in full when you've done the translation and got that all completed, Nicola. So those are two actions arising from that. So we're 9 minutes over time. We're now going to have a short comfort break, and I suggest we come back at 11:40. Oh. I've lost my. Got it. So, roll back. I think I'll restart the meeting. Croeso nôl pawb. We now come to item 6.3.0, the Delivering Excellence Performance Report for the period September 2021. And I'm going to ask Kath O'Brien to take us through the key performance issues for both the Cancer Centre and Welsh Blood.
Thank you,
Kath,
Chair.
I can see you there. Yeah.
Oh. Sorry, I can, yeah, sorry, problem with sticky mute button. Thank you, Chair. I'm going to cover off a focus on a couple of the indicators in more detail than the others. The full report is there in terms of the summary paper, and we had a comprehensive overview of that as well within the highlight report for the Quality and Safety Performance Committee. Before I start on that, I really would just like to recognise that I think there is some more development that we need to do, as Stephen highlighted, and pick up further discussion with Stephen Allen, but also to really in terms of setting the context and making sure that our narrative is easily understandable by members of the public. And so we will be focusing on continuing to improve our narrative as we go forward. Also recognising that our performance framework document is under review, and that we're intending to, in fact, Phil Hodgson's with us today, and that's one piece of work that falls under his jurisdiction. And we